Hi, I'm Masatoshi Takagi from the Department of Pediatrics and Developmental Biology at TMDU. Today, I'm going to share an updated research result about myeloid NK cell precursor acute leukemia and give you a better understanding of what it is. Has anyone heard of myeloid NK cell precursor acute leukemia? It does sound a little wrong and difficult, doesn't it? Leukemia is a cancer of the blood. Several types of leukemia are known to exist. The most typical types of leukemia are acute myeloid leukemia, acute lymphoblastic leukemia, and chronic myeloid leukemia. These three subtypes account for more than 90% of all leukemias. However, there are quite a lot of rare types of leukemias. For example, myeloid NK cell precursor acute leukemia is known to be one of them. What makes this rare leukemia stand out is that nobody has ever really looked at it before. So we don't have a solid understanding of how it develops or what the best treatment is. Myeloid NK cell precursor acute leukemia commonly occurs in East Asia and is not categorized in the current WHO classification. The characteristics are featured by extramedullary involvement and positivity of myeloid and NK cell antigen. Although we can cure more than 90% of childhood acute lymphoblastic leukemia, the outcome of this leukemia is poor. So Akira Nishimura, primary investigator of this research project, will let you know the detail of the results.
Hi, I am Akira Nishimura from the Department of Pediatrics and Developmental Biology at TMDU. I am going to present our data. Throughout our molecular research, we revealed that myeloid NK cell precursor acute leukemia (MNKPL) showed a distinctive profile from previously known leukemia subtype. As a molecular feature, MNKPL is characterized by higher expression of Notch1 and LANC3 that requires NK cell differentiation, and lower expression of a master regulator of T cell differentiation, BCL11B. So we have transduced LANC3 into immature leukemia cells, which express lower BCL11B and stimulated with Notch1. The cells expressed NK cell marker CD56. We also identified that MNKPL showed lower expression of SNS by hypermethylation of SNS promoter. Decreased SNS induced the cancer cell death through chemotherapeutic agent erasparginase. What is interesting is that in our cohort study, the cases treated with erasparginase addition to AML-type chemotherapy achieved a higher remission rate and showed long survival. Next, I would like to discuss the differentiation of blood cells in the context of the pathogenesis of MNKPL. Traditionally, NK cells have the same origin as lymphocytes and differentiate from lymphocyte progenitor cells. However, recent studies have suggested that blood cell differentiation is more complex, and that some progenitor cells of myeloid lineage have the potential to differentiate into lymphocytes. We performed single-cell trajectory analysis using MNKPL cells, normal bone marrow mononuclear cells, and CD34 positive hematopoietic stem cells to evaluate the differentiation stage of MNKPL. MNKPL locates in the middle of the differentiation trajectory from hematopoietic stem cells to NK cells having contact with myeloid progenitor cells. Therefore, MNKPL have both myeloid and NK cell characteristics. Now, NK cells are classified as innate lymphocytes and exhibit antigen-independent cytotoxic activity just like neutrophils. Based on these two observations, we speculated that there are progenitor cells that have the potential to differentiate into myeloid, NK, and T cells, and that MNKPL arises from the progenitor cells that have lost the ability to differentiate into T cells.
Through this research, we present two key messages. First, despite the disease being rare, there are still patients out there. Being a common disease, many physicians have experienced it. Clinical trials have been set up, and the standard treatments have already been established. But with these rare leukemias, figuring out how to treat them is a real challenge. Also, there are few doctors who treat the disease, and few researchers who study it. Therefore, the development of appropriate treatment option hasn't really moved forward much. We really need to shine a spotlight on these rare diseases. And secondly, we uncovered that NK cells have originated from mild progenitors, and transduction rank 3 and notch stimulation to immature leukemic cells triggers NK cell phenotypes. We are thinking that this strategy could also be used in developing NK cells for cell therapy. Thank you for watching. I hope you got a better view of the what myeloid NK cell precursor leukemia is.